The World Health Organization country representative in Nigeria, Walter Kadazi Mulumbo, wants member states to redouble their commitment in the implementation of accelerated plans that could reduce the spread of malaria and save the lives of its population. Mulumbo made the call during a roundtable conference to commemorate the World Malaria Day and African Vaccination Week in Abuja. The conference also provided updates on vaccination in Nigeria, as well as recommendations on how to provide coverage.
The 2021 Nigeria Malaria Indicator Survey report shows that the malaria prevalence in the country has reduced from 23% in 2018 to 22% in 2021. However, Nigeria still has a long way to go in ensuring malaria is eradicated. As the world marks the 16th World Malaria Day, WHO and its partners at a media roundtable gave updates on successes recorded in the fight against malaria and called on key actors not to relent in the fight against the eradication of the public health enemy.
New tools and strategies are needed to address the threat of drug resistance, insecticide resistance, and new invasive vector compromising gains in vector control. In this regard, we recently launched 2 strategies to support countries in the African continent as they work to build a more resilient response to malaria. A strategy to curb anti-malaria drug resistance and an initiative to stop the spread of new invasive Anopheles stephensi malaria vector. So fighting against malaria vectors will require multi-sectoral action and the involvement of decentralized administrative units and communities to sustain behavioral change and uptake of these new tools. A new global framework to respond to malaria in urban areas, developed jointly by WHO and UN Habitat, guides city leaders and stakeholders. We will prioritize this segment as part of the 2023 campaign and the critical importance of reaching marginalized population with the available tools and strategies to reduce transmission for present and future gains. Malaria programs should be decentralized to the district and community level where health systems are closest to the affected population.
With about 6 million children in Nigeria yet to receive any sort of vaccination, the Africa Vaccination Week is with the theme, The Big Catch-Up, a year-long campaign for WHO and its partners to intensify efforts to reach children who miss the vaccination and encourage more awareness on the need for citizens to demand and access immunization services.
We still have about 6 million children that have never received any dose of vaccine. So reaching these children will require renewed, intensified efforts by the government and partners. And to galvanize the commitment required, WHO conducted a high-level event during the African Union Summit in February this year, where African heads of state endorsed a declaration aimed at revamping and scaling up routine immunization across the continent and implementing urgent measures to address persistent bottlenecks in vaccine and healthcare delivery. WHO since 2015 issued revised immunization schedule to support the big catch-up, where children who have missed being vaccinated can be safely vaccinated with appropriate vaccines. This is part of over 15 guidelines and strategies issued to countries, including Nigeria. We are supporting the NPACDA engagement with the 33 states and the FCT to develop tailored strategies to reach zero-door children and unimmunized children.
As access to malaria treatment is seen to be a fundamental human right, vaccination and immunization should be supported to save generations from preventable diseases. Oyebimpe Wealth, AIT News, Abuja.